Close to 150 healthcare providers from various sectors gathered on November 16th to learn more about the health issues facing Aboriginal communities.
This year's Aboriginal Health Symposium was a joint effort by the Erie, St. Clair and the Southwest LHINs, and we wanted to focus our theme on 2 points. One was innovative partnering, and the other had to deal with inclusive health concepts.
The keynote speech was delivered by Chief Ovid Mercredi, who spoke about the issues of jurisdiction and how it impacts health outcomes in his home of Grand Rapids, Manitoba.
At least we have water and sewer in Grand Rapids, and we've had it for 10 years. But off reserve, where my mother lives, there is no water and sewer yet. But when Hydro came to Grand Rapids 40 years ago, they brought in their water and sewer for their houses. So that all the Hydro employees, all the white people that came, they had their water and sewer. Because the government made sure that white people were treated fairly. It didn't matter that they destroyed our way of life, that they flooded the place our people used to travel. Where I spent my first 3 years as a child, or 3 months. It didn't matter to them that they were destroying a culture. What mattered to them was economic development, creating electricity for the people down south, and creating some wealth from selling that electricity to their people or to some other markets. That's what mattered. So I know what inequity is. I saw it growing up in Grand Rapids, where the Hydro employees had their water and sewer and their electricity. And my mother was now 89 years old, has yet to turn a tap to get water. We're not into improving services that we don't have. We're at the stage of seeking services that other Canadians have taken for granted for the last 50 years. That's the situation in this country. And that's one of the legacies of colonization. And people need to stand up with us. They need to say, okay, enough of this. And we want substantive change, not ameliorative reforms. We don't want step by step. Step by step means that more kids commit suicide. Step by step means that more of our old people go without seniors' homes.
So we wanted to start this process with education, and hopefully also bring people together from different LHINs, different sectors, between the Aboriginal and mainstream health service providers, helping people get to know one another better, to examine ways that we can do our work better, to improve our use of existing knowledge, and basically with an eye to develop more innovation, more creative partnering, so that we can actually get to the root causes and deal with the root causes of the Aboriginal health situation that's in the communities, and to basically, at the end of the day, increase health status.
A second presentation came from Dr. Marilyn Cook, the Chief of Staff at the Winnebago Area Health Authority. She spoke of her experiences working in remote areas of Northern Ontario and the constant struggle to marry traditional healing practices with modern Western medicine.
And within the system itself, very little heed is put to spiritual healing. So, and I said this in 1991, because shortly after I graduated and started working, and they had asked me to come and speak at a physician's forum, a forum on physician retention. And all the who's who of the medical community of Canada was there, all the deputy ministers of health, ministers of health, federal and provincial, all the deans of medicine. And I had my shield and I said, when are we going to start looking at the system as a whole and start helping people heal all aspects of themselves? And you could have heard the pin drop. And more as I speak now, people are more accepting and people are asking more of how do we do this? Because our medical system is in a big state, it's in a big mess. It really is. I mean, when you look at us as Aboriginal people, as First Nations people, we have more access to drugs and doctors now than we ever have. We're sicker now than we ever have been. So I say to the leadership, that we can't just fight. We need to fight for the best of Western medicine, but we cannot put all our eggs in that basket. Because I know if you put 50 more doctors in every one of our First Nations communities, our communities are not going to get healthier. The prescription drug abuse that is rampant in our communities all over the world is just unreal. And in '98, when I was doing, looking at the prescription drug abuse within Manitoba borders, and I go with the College of Physicians and Surgeons and the Pharmaceutical Association head, the licensing bodies for physicians and pharmacists. And we do community profiles, so we were able to pull up everything the community was using, their top 10 drugs, and usually 8 out of 10 of them were narcotics, or antidepressants or tranquilizers. So, but the chiefs always said to us, this problem did not start in our communities, it came from outside. Our communities are in a lot of pain. When you've been told that your ways are no good, that you're no good, and you're perceived as, the drunken Indian, those are painful experiences.
Lee Steers-Loft, a patient navigator at the Juravinski Cancer Center in Hamilton, spoke about her role in helping Aboriginal patients find their way through what can be a foreign and scary Western medical system.
It is a foreign system. It's very hard to ask someone to come to a cancer center, even the word cancer. So there's so many myths and misunderstandings, and there's so much stigma around the word cancer. And so when someone is diagnosed, it's usually when they're really, really suffering. I cannot believe how our people can really hold themselves so tight. We sometimes there's a new diagnosis, and the person will pass within a few weeks because they've been holding that, even from their families. Their family knows that something's just not right with that person, but they really hold themselves with a lot. And so we present late. We present not when it's stage 1 and it's just in one little area that's easy to treat. We come at stage 3 and stage 4 for the cancers. And so it's very, very hard to find cures.
The day also shone a local spotlight on the Aboriginal aging at home and access to care programs. Representatives from both the Erie, St. Clair and Southwest LHINs also addressed changes to mental health programs. The afternoon wrapped up with lessons from Oneida elder and healer Bruce Elijah.
What we're addressing to is less than 10% of the population of our communities. Our people don't like to go to a hospital. We call it a place to go to die. And so our people don't like to go to hospitals. And so we have to do the home visits. So we're busy. In our community of where I come from, we have approximately 3 to 5 ceremonies every night, 365 days of the year.
This day was it was intended as a day for food for thought. So basically it was to sensitize the health service providers around the real issues that Aboriginal communities face, whether they're on reserve or in urban communities, whether they're First Nation or Métis. We wanted to begin opening the minds and understanding around cross-cultural issues, around cultural awareness, things that have a direct and immediate impact on how care gets delivered in our communities, and then also when our community members come into mainstream systems and interface with those systems, how to improve the understanding for that care. And so that's basically what we wanted people to come away with, and I think we were successful. Our evaluation shows that people were quite satisfied with the speakers that we chose for that day, and it was very encouraging.